Hello, and thank you for listening to my presentation. My name is Ronnie Meechan-Rogers, and I am the Head of Education at the Institute of Clinical Sciences at the University of Birmingham. I'm also the Head of the Pre-Registration Nursing Programmes here at the University. I'm here today to talk to you about a research study that we are undertaking within the School of Nursing in the Risk, Abuse and Violence Research Programme. We're looking at something called image-based sexual abuse. You may know it more commonly as revenge pornography. And we're looking at the impact that image-based sexual abuse or image-based abuse or technology-facilitated violence, as it's sometimes referred to, in the LGBTQ, the lesbian, gay, bisexual, transgender and queer questioning community, and the impact that has on their mental health. As far as the research team is aware, this is one of the first studies that is examining image-based sexual abuse within the LGBTQ community exclusively. The study is also interested in looking at the impact that image-based sexual abuse has on victim survivors and their ability to be able to access services such as mental health and wellbeing services within the UK. We're going to give you a brief overview of the systematic review and some of the findings that we've had from that, and also some preliminary findings from survivors and victims themselves. The study's been undertaken during the COVID-19 pandemic, so we're going to look at some of the data that we've got in relation to that as well. And then we're also going to summarise what the stakeholders are telling us about some of the challenges that victim survivors of image-based abuse experience on a day-to-day basis. So some of you might be asking, well, what's the relevance of image-based sexual abuse within a nursing and healthcare context, and why is this important? So developments in technology have extended the ways in which image-based sexual abuse can be enacted. And a developing form of violence and abuse is the production and dissemination of personal intimate images. And this is a phenomenon that's much more commonly known as or conceptualized as image-based abuse. Now, the term image-based sexual abuse tends to be used synonymously with revenge porn, but the term revenge porn is problematic. So, whilst in some instances it can provide a framework to understand the wider discussion of sexual abuse, particularly in relation to legislation, the term revenge porn really is a media-generated catchphrase. And although this definition is probably commonly understood with yourselves and the general public, it really relates to a malicious subsection of private sexual images. And the term revenge porn really focuses on the motivations of perpetrators rather than the harms to the individual whose images have been shared. The term also feeds into the notion of revenge for some kind of behaviour and also implies that victims have some way engaged in pornographic behaviour, and this couldn't be further than the truth. So the adoption of image-based sexual abuse within this presentation is deliberate. This term encapsulates non-consensual sharing or threats to share intimate images of a sexual nature or digital recordings or something called deepfakes, which is where individuals' images are altered in some way. And also what the term of revenge porn also doesn't really cover is that actually within image-based sexual abuse there might not be any motivation of revenge or financial gain, but particularly within the LGBTQ community, what we're finding out from individuals is that there can be some other factors, such as purposefully trying to out somebody in terms of their sexuality, or people that might have a very strong faith base. Sometimes image-based abuse is used as a way of outing those individuals within their faith-based communities. So we're going to go on now to the next slide. So to contextualise image-based sexual abuse within the LGBTQ community and the context, so why specify a focus within that community? So some research that's come out of the National LGBT Survey, but also research that's come out of Australia and the States, is identifying that individuals who identify as LGBTQ may be experiencing, or are reporting rather, higher incidences in comparison to their heterosexual peers. So you can see on the slide here the Data and Society study that's there. That was a study that was undertaken by Lenhart in 2016, and they identified that there was a significant difference in behaviours relating to sharing of non-consensual images between those who identified as LGBTQ when compared to their heterosexual peers. So individuals that identified as LGBTQ were reporting around about 7% that were experiencing non-consensual sharing of images in comparison to 2% of their heterosexual peers. LGBTQ respondents also reported significantly higher levels of threats or actual sharing when compared to their heterosexual peers. And about 15% of those who identified as LGBTQ in terms of internet users, and this was in the US, identified that actually somebody was intimidating them in relation to posting a sexual image. So this is some 4 years ago. Research that's been undertaken in Australia by Anastasia Powell and Nicola Henry and other researchers have identified that LGBTQ individuals were much more likely, about 36%, than those who identified as heterosexual, 21%, to report that they've been the victim of image-based abuse. But currently, as far as the research team are aware, there haven't been any specific studies with a specific focus looking at the impact that image-based sexual abuse has had on LGBTQ individuals, specifically in relation to health and well-being and their ability to be able to access mental health services. So that's really the focus of this study. So on this slide here, what we've tried to do and what I've tried to do is to capture some of the high-level findings of the systematic review. We've laid this out using something called the Pager framework. The Pager framework looks at patterns, advances, gaps, evidence for practice and research recommendations. And we thought this would be quite an interesting way to try and capture the main findings of the systematic review that was undertaken. So one of the patterns and gaps that emerged from within the review was that there was really a complete dearth of literature with a specific focus on LGBTQ individuals, including image-based sexual abuse and the harmful impact that this has on them. When we considered the wider constraints of image-based sexual abuse, looking at things like sexting, legislation, cyberbullying, online abuse, these areas were slightly more developed in terms of what we found in the literature, but there was a much clearer focus on younger individuals in terms of sexting, and very, very little literature that looked at image-based sexual abuse within the LGBTQ community, particularly within adults. And this is despite research coming out of Australia and the States identifying that those in minority groups such as the LGBT community are reporting much higher levels of image-based abuse. And one of the other gaps that we looked at was there was just a general lack of research, as I've said, within the adult population, and where sexual minority or sexual orientation communities were asked or surveyed as part of the research, often the sample sizes were so small it was really difficult to draw any relevant conclusions from those studies. One of the other patterns and gaps that was identified and is on this slide here was that it was quite difficult to be able to identify any studies that had a focus on the impact that this has on mental health. There was a paper published by somebody called Samantha Bates in 2017, 2018, looking at revenge porn. That sample size was primarily based around heterosexual women, and so there's much more research is needed in this area. And finally, in terms of this slide, the vast majority of literature that's been published in terms of image-based abuse, or image-based sexual abuse rather, is being published in Western civilizations and Western countries. So for us to really understand this phenomenon more generally, we really do need to be undertaking research, focused research on image-based sexual abuse from a non-Western background to get a much better understanding. In terms of some of the preliminary findings from those that identify as victims or survivors of image-based sexual abuse who have been participating in this study, we have been interviewing individuals from the United States, from Canada, from Switzerland, from Australia and New Zealand. We continue to interview participants as part of this study. The study's main method has been undertaking online interviews, semi-structured interviews with survivors, and we've been looking at those individuals who have come forward to share their experiences with us. And primarily, these are the main areas that individuals are telling us about in relation to their mental health. So as you can see there on the slide, I would say of the participants that we have interviewed, overwhelmingly most participants talk to us and tell us about having suicidal thoughts or attempts at suicide after they've realised that somebody has either released the images amongst their networks or friends online. Some of these have been put onto platforms such as Pornhub, for example. Other individuals have had their images or their videos shared with their work colleagues, etc. Sextortion has been an issue. This is particularly amongst the male participants of the study and those who identify as gay or bisexual. Overwhelmingly, all of the individuals that we have interviewed have told us that the enactment of image-based sexual abuse has had a significant impact on their mental health and on their well-being and on their general well-being. The vast majority of individuals withdraw from any online activity or online presence whatsoever. And when you listen to the individuals who have participated in the study and they talk about their experiences, they are very closely aligned with individuals who would present, for example, with post-traumatic stress disorder. Overwhelmingly, people talk about feeling depressed and anxious. Many of the participants have told us that their alcohol use or drug use has increased or become out of control in some instances. Others have talked about some behaviours that they may have experienced maybe in their teenage years. Things like eating disorders have then resurfaced. Overwhelmingly, people talk about a loss of self-esteem and issues with trust and building relationships following this experience. And then from an LGBTQ perspective, many individuals who might not be out, so those particularly who might have a very strong faith base where that's really important to them, and that might come into conflict with individuals knowing that they are gay or lesbian or bisexual, trans. For example, outing has been a significant factor there. And then, as you can see there on the slides, some of the individuals that have told us about their experiences have lost their jobs as a result of this, or lost family networks or friends, or even relationships have broken down because of the anxiety, stress, etc. We've also been speaking to system regulators and stakeholders as part of this project, and these groups here are just some of the organisations who we have spoken to as part of this study. All of these organisations, with the exception of the Law Commission, who we have spoken to as they are revising the legislation surrounding the Communications Act that governs revenge porn and image-based abuse. All of these other organisations have told us that there has been a significant increase in cases of image-based abuse, particularly since March of this year, when the country or the planet went into lockdown as a result of the response to the global pandemic. There's a number of factors that are involved in this. Individuals and households were separated as we went into lockdown, so the engagement in online activity increased as a result of that. But also there's been some evidence of some targeted albeit pernicious activity whereby people are receiving emails, for example, saying that that people have images of them, they may or may not, and then sextortion or manipulation, financial manipulation, then becomes part of that. The Revenge Porn Helpline, NetSafe New Zealand, the eSafety Commission in Australia, the Legal Advice Centre, for example, in London, all organisations who support individuals who have been the victim of image-based sexual abuse have been reporting that there have been significantly higher numbers of reports of image-based abuse across all age groups. Particularly, and individuals are telling us as part of this study that is absolutely the case, and that they are reporting higher levels themselves as a result of that. So this is the final slide for the presentation. So firstly, thank you for listening. We've been taking or collecting data rather from individuals during the COVID-19 pandemic. And as I've said on the previous slide, all of the system regulators and the helplines have been telling us that there's been a significant increase in this type of crime, this type of behaviour. As I've said, it is primarily due to this move to online. All of us have been living this new online world with Zoom calls or meetings or team meetings, etc. But wrapped up in all of this are individuals and victims who have experienced image-based sexual abuse firsthand. And this move to these online ways of communicating has caused significant impact on those individuals' mental health. We're all, at the moment I'm doing this, so I'm sat in front of the camera. For victims or survivors of image-based abuse, the camera is the thing that has caused the greatest deal of anxiety and distress for those individuals, with those images being sent without their consent, and now those individuals are having to engage with online activity. So coping strategies that individuals may well have had to be put to one side because employers have expected all of us to engage with the technology, to engage with these online meetings. So individuals have been telling us that they're getting re-emergence of symptoms such as anxiety, depression, insomnia, that alcohol use has gone up as a result of COVID in terms of the impact on that individual's mental health. We're also being told that individuals are having to tell employers that they may have been the victim of image-based sexual abuse, so that element of control over their private life because of COVID and the way in which we are all being expected to move online has also had an impact. So COVID-19 has and is having a significant impact on individuals who are victims of image-based abuse. So I'm just going to summarise very quickly. So if you are a practitioner, whether or not that's working in mental health services, the emergency department, you're a practice nurse, and individuals come to you because they've been the victim of image-based abuse. Victim blaming is a real risk. The individuals haven't asked for those images or videos to be released or sent without their consent. So, you know, they're wanting support. So go online, look at the Revenge Porn Helpline, look at the Legal Advice Centre, look at Victims of Internet or Image Crime. Those are the organisations that can help. Survivors UK is an organisation, an organisation for men rather, who have been the victim of abuse or sexual abuse, etc. They've set up a support group for men who have been victims of image abuse or image-based abuse. Get the general practitioners involved in supporting individuals, and also the police. It's a crime, so you know, we need to encourage people and support individuals when they've experienced this. So thank you for listening to my presentation. I hope that you've found that useful.